For somebody who's had an intervention but doesn't typically have any kind of clotting disorder, for instance, I think me, I asked to go off of blood thinners because of all the bruising and the other issues I was having. And eventually my cardiologist and my interventionist, whatever, he said yes. So I am not on anything, but he kept me on it for the appropriate amount of time after the intervention. What is your take on that? Is that appropriate for some patients?
Honestly, not being on anything is not ideal. At least
an
aspirin.
I'm on it.
Okay, good. Yeah. So that's, the fact is, again, it's one of those things we don't know. When you say exactly what you just said, the appropriate amount of time. Well, where did that come from? Well, that came again from the cardiology literature. The appropriate amount of time is somewhere between 2 to 6 months. Both basically the American Heart Association and the European association that deals with P.A.D aspect in terms of guidelines have both put out very, very, very weak guidelines by their own accord. I'm not saying they're weak. They say it's weak evidence to say somewhere between 2 to 6 months after your procedure, you should be on some type of antiplatelet. Now we have some new data saying, you should also get this partial bit of anticoagulant, which is the 2.5 of Xarelto twice a day. But really, again, nobody knows. And again, I think we're still approaching it wrong because we're saying, well, you had this surgery, you need this. But, women have less what we call comorbidities. So they've got less risk factors of having P.A.D than men. Yet they get their legs chopped off more than men, and they get wounds that don't heal more than men. And what we have found in our research at Mass General is that the reason for that is on the same blood thinners as a man, a woman's platelets continue to work. So you're trying to make the platelets stop working, right? But women's platelets are hyperactive. They need more to shut them down. And so all these years we've been thinking, women have blood vessels that are smaller. Maybe that's why they clot off. But actually, no, there's a scientific reason why they are not getting the same benefit from the blood thinners as males might be getting. The point, and again, this is extremely crude research. We're like digging in the sand, and we're looking at the edge of what might be a treasure box. So we got to keep digging. We got to keep digging. So, I'm hesitant to say, hey guys, this is the new thing that we need to do. We need to get out there and we need to all be testing our blood. One thing I will say is that the way that we manage blood thinners today is not appropriate. It's the best we can do because it's the best research out there, but it's inappropriate, and we need more research and more effort in this realm, because all these multi-million-dollar interventions we're doing on people to get their blood flow open is pointless if you can't keep the blood flow open. The maintenance, if I build you a beautiful house that immediately blows away when you have your first windstorm, what was the point, right? You need something that's going to maintain, sustain, so that you can keep that leg on your body. Getting a procedure once in a while, every three years or something, fine, but not every 6 months.